Hey guys, this is FFS with Dr. Cari, for fuck's sake. Today we get to talk with Kim Riley Brown. She is a nurse. She's been in healthcare for 18 years, and she is really into patient advocacy, as you would be as a nurse, and the community and wellness. And so she is eager to explore new ideas and connect with fellow enthusiasts through meaningful dialogue. And I have known Kim for almost a couple decades now.
Yes.
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 So how did we meet?
In the ER. I was an ER tech and you were the physician, and we kind of just started vibing, and I realized that you had a young child. And so being my young self, I was like, hey, I'm a babysitter. I'm well qualified. Let me take care. So I kind of started, probing all of you physicians who had young children, because I was like, hey, this is a great moneymaker. I'm clearly qualified, right? So, so I started coming over and babysitting your kiddo.
That's right.
Yeah.
How old was he?
Little, maybe 4.
Yeah.
5, maybe.
I wanted to say, not in school yet.
Not in diapers either. So.
Okay, so in the middle.
Mm-hmm.
Yeah, and today he just finished his very last day of high school.
Yeah, that's crazy.
We're not going to talk about that. We're not going to talk about that.
Yes.
Okay, and so we both left the emergency department at different times. And so then how did we recently reconnect?
I saw you on TikTok. That's how we reconnected. I thought we were on other social media platforms, but things happen, maybe, and I saw you come over TikTok and I was like, I love this. This is amazing. I follow a ton of physicians and tons of different, medical communities. So I was like, she's perfect. She's the one. Okay. And I love that. So
it's crazy to think that I'm in my 50s and on the TikTok, and that's how.
I think it's amazing. I think it's the best.
It's a whole new world. You got to get used to it, I guess.
Technology's rough when we haven't grown up in it.
Yeah, speaking of rough, so what are you doing for work now?
I'm not. I've been doing hospice the majority of my career, but I got injured. So I'm on short-term disability. I'm kind of hanging out at the moment. I am applying for other jobs, just kind of going with the flow, taking it as a baby vacation and a blessing. So
getting some time with the kiddos and stuff.
Yep.
Yeah, so this hospice gig.
Yeah.
That's not for the faint of heart.
No, and I didn't jump into it like I wanted to. I left the ER and I was like, I save lives. That's what we do. And then it's like, well, you need a job, right? And it's like, we have a position. I'm like, oh, I don't think that's for me. My heart hurts. I don't think I could do that. And I was kind of thrown in, and I cried a lot. And every time I've left hospice, I come right back. So it's almost like 12 years in and out of hospice.
Yeah.
Yeah.
So what do you love about it?
The connection. I like going to people's houses. I'm a very emotional person, a very intimate, empathetic person. So I like being in their houses. It's different than the hospital,
Oh, yeah.
You're in their area, their zone. They trust you. They feel comfortable with you in their house. I'm on their territory. They're not on mine this time. And that opens up some vulnerability that people, I don't think, understand. So I really enjoy that, like being in their houses with them.
Yeah, I always thought, as rough as it was in the emergency department, to see people come in and just banged up and torn up and covered with whatever they're covered in. We weren't the people that got them out of the house. We weren't EMS, we weren't police, we weren't the paramedic. We kind of got the pseudo sterilized version.
100%.
Yeah.
Yep.
And so being in people's homes is so intimate.
It was almost like a shell shock, and I'm having these different types of conversations, and I feel very uncomfortable at first, and I don't know how to act. I don't know how does this happen when you're in somebody's house and I'm your medical professional, But it ended up, I don't know, maybe I'm just a people person. I vibe really well with people. So I end up being like their family, and I get to know them, and I go to services with them, and I've been in a couple different obituaries being honored. So I think it's my jam.
Yeah, I think it sought you out because you're obviously the type of person that needs to be in their homes and needs to be helping them.
Yeah.
And not everybody is cut out for that. That is for sure.
I've noticed that, unfortunately, meeting other people in the community. I'm like, ooh, you're not super warm and fuzzy. I'm not sure I'd want you to be my hospice staff member, but life, right? Different personalities too. I'm very warm and fuzzy. Some people aren't that warm and fuzzy, and they're like, yes, please, you can go. Thank you. So I'm like, you're right. You sure you want a hug? And they're like, no. So
I actually don't want you to touch
Yeah,
me.
I'm good off that. Right.
Okay.
Yeah. You learn boundaries.
Yeah, it's so interesting. So my best friend growing up, we've been best friends since kindergarten. Her mom was a hospice nurse, like
Oh, yeah.
all of our childhood. And and she's Welsh and she's very dry and very like proper and everything is very practical. And she scared the shit out of me as a kid because she wasn't warm and fuzzy.
Yeah.
As an adult, oh my God, I love this woman so
bet.
much. Like
Yeah.
she's so just straightforward. Let's get to it. And her sense of humor is fantastic. But I didn't get it as a kid, right?
Right.
But I totally remember sitting around having dinner or whatever. And my dad, Phil, I call him dad, he would answer the phone. He'd hand it to Thelma and she'd be like, hello? Oh, I understand. Okay. Thanks for letting me know. And he would hang up the phone because obviously the phone is here with a cord on it.
Yep, on the
That's
wall.
what I'm doing, right?
Yep.
And he'd be like, what happened? And she'd be like, oh, Laura passed away. And she'd like take another bite of her food and like everyone at the table's like, oh.
Right, this devastating thing. And it's like, oh, I'm like, oh, thank goodness. I'm so happy they went. Yes,
Right.
you know,
Right.
we've been anticipating, we were hoping. And, you know, if it goes right, if hospice is right, it's beautiful. It's kind, it's soft, it's gentle, it's spiritual. I've felt things that I can't explain just by being in the room when someone has passed. It's kind of an incredible experience. The beginning of life, the end of life, kind of wild to me, but I dig it.
Yeah. I mean, I've definitely been there when plenty of people have passed,
Yes.
but in the emergency department, it's all just chaotic and traumatic and often completely unexpected.
Yep.
And so then you're left with, I mean, it's just high adrenaline drama.
Yes.
Versus like the hospice experience, it's like everyone knows what's going to happen. This
very
is what we're
anticipated.
doing. Yeah.
That was hard. That was a hard turnoff for me because that's what it was in the ER. It didn't matter. Anyone could roll through the doors and they were barely stabilized and then you did what you did and then they were out, you know? We didn't hardly get to know their names or anything about them. We know their diagnosis, why they're in the room, do what you got to do, you know, move forward. It's totally different, right? I know these people's backstories. I have beautiful love stories, terrible tragedies. Like, I love that. I love hearing that. I think it's so cool, so wild. Learn more about life through death than I think anything else so far.
I love your curiosity about it. Like, I think that's probably what people dig so much about you is
I'm a very curious person in every aspect, right? I'm like, let's talk about it. I want to learn more, right? Everyone's so different. And I love that nothing is cookie cutter, right? I like to know your individuality. I want to know who you are as a person because you're probably not anything I've ever met before either. And I like that. Let's learn.
That's gorgeous. And what a gift to give people under like horrific circumstances, honestly. Like if you're on hospice, like something bad has already been happening.
Right.
And the stakes are really high and
I'm right. That's why we're supposed to be there. It's, you know, to go through the motions and make it as peaceful and loving as possible and get through the stages of grief and all the things that people, you know, do during this process. But it's great. It's very honorable.
Yes.
I feel honored to be there with these people.
Yeah, my dad passed away on hospice and the job that they did was just amazing. Like, and it took me out of the physician role and let me be the daughter.
Yes.
Which is pretty unusual in my family anyways. And especially like my dad, from the day that I noticed that there was something wrong with him, he had not really been seen for it. To the day he died was less than 9 weeks. Like it was,
very fast.
At the time, it seemed like it was lasting forever.
Of course.
Like every day was lasting like 4 months. And it was
Agony.
freaking terrible.
Yep.
But in hindsight, in retrospect, and especially people who were sort of on the outside were like, wait, what do you mean that he are like, well, oh my gosh, you know? And it's like, this has been going on for years.
Right.
No, it's been going on for several days.
Yeah. Yep.
And so the perspective is so wild, but
I'm glad you had a positive experience. Typically less than 5 days on hospice, people don't have a good experience. They don't perceive it as a good experience because it happens so quickly. And we didn't get to come in and get to be there with you and support you. These are, you know, signs, symptoms, anticipation. As a physician, you saw those, you know those, but probably everybody else around you didn't know what was happening probably that quick.
Right. It was actually great because the nurse, she brought in pamphlets and information, and she was like, "Do you want me to sit down with you with this?" And I was sort of like, no. So
nope.
Let's just move on.
Yeah.
But then she was able to sit with my mom and my brothers and, really explain things in depth to them without me having to do it.
Right. So you could be a daughter.
Yeah.
You can grieve and you can mourn with your family
Right.
and not be expected to explain the medical diagnosis and what's happening, because you probably shouldn't. You're the daughter.
Right.
Yeah.
And it actually, I remember specifically, it allowed me to have time with my dad.
Yeah.
Which was great because, she got to deal with the rest of the family.
Yeah.
And I got to go over there and just canoodle with him. And he was still lucid for the first day or two. And so that was really kind of special to loosen me up for that.
Yeah.
Mm-hmm. Yeah.
It's a lot of pressure on you as a doctor or anybody in the medical field. So many people feel this immense guilt, like they have they have to be the one to relay to all the family. They're the point person. They're the one. It's heavy. It's a lot on that person. So I'm glad that you were able to get pulled out and be a daughter.
Yeah, it was wonderful. I think one of the things, I'm sure that you've experienced this being in the medical field, like your family is like, "Oh, I stubbed my toe," or "This looks weird," or "I need to check out this bump."
Yeah.
And so
everybody.
they immediately come to you, which is wonderful.
Totally.
But so many people don't have that. They don't have a resource like that. They're just relying on each other and hearsay and, God forbid, the internet.
Always the internet.
Yeah. And so when I knew that my dad's diagnosis was really grave, I reached out to one of my really good friends who was palliative care and hospice. And I was like, "So it's going to be time soon. Yeah. Could you maybe come by the house?" And she's like, "Absolutely. What time?" I was like, "All right, it doesn't even matter. Everyone's just there."
Yep.
And my dad was, he was in the middle of chemo or just starting chemo, but it was not going to go well.
Yeah.
And she went over to the house and talked to him for quite a while, got in touch with my mom. She had already met them a couple of times.
Yeah.
But obviously their conversations were much different and their friendship deepened.
Absolutely.
And then, we do the chemotherapy and things are not going well. I'm kind of keeping her loosely up to date. And then it was time, like he was in the hospital and I was like, we're going to be done. And she's like, "I'm on my way." And my dad's primary care provider, as well as my friend who was the hospice nurse, like we were all in the hospital together and kind of made that decision with everybody and the whole extended family and friends who had gathered. And it was such like a huge breather that I didn't have to have this conversation of.
You weren't leading it.
Yes.
And it wasn't from you, right?
Correct.
It was from the outsiders, colleagues, people in our community, right? And that's the job. Palliative care in general, people don't understand what that means because it's not hospice, right? So palliative is there to ease pain and suffering, but it doesn't mean that you're end of your life. So the previous conversations could have been simply advanced directives, pulse, something of that nature. But it's nice to get that in the door too, quicker, right? To just advanced care plan, because like we were talking about, it doesn't really matter how old you are, doesn't matter your age or your race or anything. We all end up there, and it'd be nice to know what to do when you get there, and what you want your family to do, what you want them, it's a rough one. That's a hard conversation. And
it is.
9 out of 10 people don't have any of that.
Right.
And as a physician, patients coming into the ER, what do I do? Do I treat? Do I full treat? Do I do everything moving forward? Is that what they really want? They're 92 or are they 15?
Yeah.
It's a very difficult conversation.
It's so difficult. And especially if you don't see it coming or you simply haven't had the conversation yet. And then you've got family members that are arguing about what is the right thing to do. And it's like, this is not the time to be arguing about this. Like now we've got a new diagnosis or a new plan and bad news and all of these things are happening. And now we're going to argue about this. Like, oh my God, have those conversations while you're sitting around the table having burgers or something.
Literally.
Like on a really good day. Like, so what do you want done? What do you want done? What are your hard stops? What are I'm not putting you through this.
Even just jokingly, right? Like,
yes.
you want to be in a box or you know what I mean? What are you thinking here?
Exactly.
I'm kind of straightforward on, if I can't eat, I don't want to do it, man. I love food. I love it. If I can't taste it,
Yeah.
if I got a tube in my belly, I don't think I want to do that.
And that's kind of where my dad ended up. He had tube in his nose and then tube in his belly. And like, he's a big 260 pound Irish man who loves his beer and food.
You're right.
And now like, oh my gosh, even if you make it through esophageal cancer, you're probably never going to
still be able to
anything again.
Right.
Yeah. And that was just, I know my mom she was way more optimistic and naive.
Yeah.
And I think, you know, this was the love of her life, 60 years with this man. And there was no way that she could even rectify that in her head.
Absolutely.
But there were definitely moments where I was like, he can't eat. Like, you gotta understand what kind of psychological fuckery that is.
Right.
Like, the very basics. I mean, you come out of the womb and you're looking for a boob.
Right.
Right?
Like, yeah.
Oh, we're just gonna nix that.
Yeah, no.
How does that mess with your head?
Right. And those are only right. And I'm only talking about it. And it's because I've experienced it. And I've gone through these with so many families and even my own stuff. I had to fill out an advance directive when I did a surrogacy, right? Because God forbid something were to happen.
Sure.
You know, I'm in my 20s. I'm like, why would I need this? Even though I worked hospice, that's not going to happen to me. I don't need to think like this, but it can, and it does. And it's important to have those conversations because now I'm divorced, right? So again, who's making that medical decision for me? Because I'm a single female. My mom. Do I want my mom to make those decisions? I don't know that I want her to. I love her to death, but it's heavy for somebody.
It is. And, you know, she will more than likely precede you in death. So then you 100%. Have to like make another decision.
Right.
And so it gets very sticky sometimes.
It does.
And then you've got kids. So then, oh my gosh. So I feel like that morphs and changes a lot.
Yes.
And I think it's almost something that keeps people from actually doing the paperwork.
100%.
Right? Because they're like, well, in 3 years, this could look different.
Right.
And it's like, no, do it because you don't know if you're going to make it those 3 years.
100%.
And then once it changes, pay the couple $100 to your trust attorney or whatever to change it. But yeah, I think people put it off for a long time.
More than even simply the pulse, right? Talking to your physician about a pulse, about whether you want do not resuscitate or full comfort care. It's a conversation. People don't want to have it. Doctors don't want to have it.
Doctors
don't like to have that conversation.
No, we
don't. We save lives, right? That's what we do.
Yeah.
Let's talk about preventative medicine. Let's talk about wellness. And it's uncomfortable for everybody. So that's part of the advocacy of speak up. Find someone you trust, find someone who supports you, regardless of what that looks like, and keep going back. Your gut will tell you what's right and what's wrong every time. If you know there's something else and that provider's not talking to you, that's okay. Go find another one. Find someone to listen to you and speak up.
Yeah. I mean, you do have to advocate for yourself, especially if you don't have a friend or a family member 100%. To be your advocate. And I that's one of the things I'm trying to change with taking on concierge patients, right?
Absolutely.
Is like, I can be that person. We can have these conversations and I can help you navigate, through these things. But it's so true. I mean, there would be dozens and dozens of times where I'm admitting somebody from the emergency department and the hospitalist is like, what's their code status? And I'm like, I don't know what they say when you asked them because I didn't ask them. Right. And it's like, they're here for something awful and it either slipped my mind or I didn't want to.
Right.
And so then, we'd kick it back and forth and somebody would have the difficult conversation.
Absolutely.
But yeah, and I found oddly, a lot of oncologists don't want to have that conversation.
I'm glad you said it and not me because 100% our oncologists and our radiologists are not super great at that conversation. They will offer treatment as long as you can get there, knowing that most of us know they can't get there. So treatment will always be available. But the conversation of, are you strong enough to get there?
Right.
Can you go to the rehab facility and do rehab for 2 hours a day for the next 6 weeks? If you're strong enough, then maybe we can get you to chemo. Then maybe we can get you to radiation. It's a lot of vague gray area that patients experience. And it sucks because by the time, I get to them, they're like, I was curious. I didn't know. I wish someone had told me or whatnot, right? And then they end up on the internet getting crazy information over the wildest things. And it's rough. It's a little rough. But hopefully we'll change that. One day at a time.
Yes, that's right. One day, one patient at a time.
100%.
I do have to, I cannot imagine going into oncology and having to have those conversations so much. Of course you get wins. Of course, like, patients of yours survive and do great and go on to like send you flowers later from,
right.
Hey, I made it to Europe.
We love that.
But it's just incredible to me sometimes where I'm like, wait, you've been on chemo for 6 months and you've never had the conversation of what happens when you get septic or like you can't take it anymore and how come this has not happened?
You get a break. You get a hip break,
yes.
A fracture, something else happens that stops your treatment, and then now what?
Yeah.
Right? Now we're on hold, so that means the cancer is going to continue to progress and the wheel starts over again. It's a lot.
It is so heavy.
It's very heavy, and it's a hard place to be, I think, for some of us healthcare workers, right? Because you want to help everybody. You want to fix the world. That's why we came here.
Right.
And your hands are tied in a lot of different aspects. And
let's go back to the pulsed.
Yeah.
Because I don't think many people know about that.
No, yeah.
So it's funny because one of my attendings in residency started that.
Really?
Actually.
I love that.
Yeah.
Good.
And so at the time, Arizona was one of the only states that had that.
Right.
And they'd like bring in their bright yellow sheet from the refrigerator.
It was a thing.
Was it pink?
It's pink. It's bright pink now.
Yes.
Yeah.
I think it was yellow at the time. And maybe it was because in Arizona. I'm just picturing it in my head. But yeah, so the big pink piece of paper that goes on your refrigerator or in your freezer, oddly.
That's cool.
Yeah, because the paramedics will look in both places, usually.
All paramedics are trained to look for that.
Yep.
They will immediately walk into a door or into a patient's house and go directly to the fridge because that's where they're all supposed to be. Sometimes group homes, other facilities, they'll be above the patient's bed, but typically that's how we know what to do moving forward. And if you don't have that, we're going to do what we can to save your life.
So what does the pulse say, Kim?
There's a couple different areas in there, which it's kind of nice because you can individualize it to, hey, I don't want artificial food or nutrition. I don't want a tube in my belly. Down to, I don't want IV fluids. IV fluids could just really just be normal saline, right? Or it can be an antibiotic. It could be all sorts of things. It could be morphine, for all you know. It allows you to really dictate what it looks like if you can't speak for yourself and who you want to speak on your behalf. A lot of times you don't know, right? And it's like the physician and you have this conversation. You're like, I hope you as my physician will have the best interest in my heart. These are things that I'm thinking I wouldn't want done if I were in this scenario. It's supposed to be a conversation between the physician and the patient every time. Sometimes it's not. Sometimes it's a nurse having the conversation. The biggest thing is understanding exactly what you're saying, exactly what you're signing. And again, the purpose is you're unable to speak for yourself and make your own healthcare decisions. What do you want done and who do you want to make the decision for you? Those are the big things. And if you're not in healthcare and you don't know, CPR, breaking your ribs, making sure your heart starts again, possibly putting a tube down your throat to help you breathe artificially, and possibly a tube in your belly to feed you artificially. Those are life-saving treatments that would occur if we didn't have a pulse in place and you were a full treatment. Those are the things that we were going to do moving forward.
Yep. And CPR is brutal.
Very brutal.
If you do it correctly and you're trying to actually anatomically force the pump to work because it won't beat on its own, we break all your ribs. All of them. Both sides, everything. That's the only way to actually properly get it done. And so that's one of those horrible things, like especially if you get older people and your chest cage doesn't actually have any give to it.
Yeah.
And then we start pounding on you. That's not kind. That's not a good thing. Like if your death is imminent or your quality of life has been in the shitter for a long time, the last thing you need is one of us jumping up and down on you, which is exactly what happens. And then forcing your mouth open and sticking a tube down. Like, it's not nice. Now, if you are healthy and you were a trauma or you had a heart attack or like something happened that was acute that you are unexpected
It's a little different.
Yeah, it's totally different.
Yeah.
Like full force, let's go. But yeah, I don't want that. It was a weird conversation to have with my parents, because they didn't have the pulse, and then both of them were sick at the same time. My mom had a stroke, my dad had cancer. It was all just culminating at the same time. And I was like, you both need to have this. And my mom was sort of like, I don't need that. And I was like, you are in your 80s and you just had a stroke. You are absolutely filling
You're my candidate right there. You're the one.
But she never wanted to have those conversations, Kim. It was so
Most
bizarre.
people don't.
Right.
That age group, 100%. Everybody
This
head
was
in the
back
sand.
in like her 60s.
Oh, see, yeah.
And we're literally having like family dinner with the cousins, and it was a potluck, and we're having beer, and we're all just sitting around, and the cousins were just as old as my parents. And they're like, well, what do you want to have done? This is a funny story.
Yes.
So these two were siblings, brother and sister.
Mm-hmm.
He was a brother. He was a monk, and she went into the convent. She was
That's
a sister.
super cool. I like that.
I know.
That's
super
interesting. Yeah.
Catholic-y. And so they both had come out of their different places and vows of silence and such to take care of their dad when he got sick. And so they lived really close to my parents, and we would always have a bunch of food and giggles with them. Hilarious.
Love it.
And so we were having that conversation of, what do you want done?
Yeah.
And my mom just, boop, she would not say a word. And she is super religious. And I was like, did
it almost take you back a little bit?
Do you want to meet your God? Like,
sure.
What? And she's just like, mm-mm. And I said, well, Pa wants this and that. And then he's thinking about this, because he was doing all this research when he wasn't sick. It was hilarious. But he wanted like the most planet friendly. Yeah.
Like the biodegradable urns type thing. Yeah.
Exactly. He was like, I'm going to be a tree.
Yeah, that's me.
That's
what I chose.
And it wasn't, he actually wanted to be cremated.
Mm-hmm.
And then my crazy friend Colleen, whose crazy cousin owns mortuaries.
Yeah.
He was like, do you know how much gas it takes?
No. Does it kill it? Oh, it's a lot. Oh, so that's a whole nother. I had no idea. No.
200 gallons of fuel per body.
Really? Who would have thought? I would have never in a million years. I've even done like mortuary tours and stuff in hospice. I got to see all the things. Yeah. They didn't mention that.
No.
I guess it makes sense though.
I mean, it does, because you have to be really hot to break down bones and all that stuff. Yeah, I was going to
say the bones, yeah.
200 gallons of fuel. And when my dad heard that, he was like, well.
Just kidding.
We need a different plan. And so then he started looking at all sorts of stuff. And so I was telling my mom about this, because he wasn't at dinner for some reason. And she was just like, I don't want to talk about this. I don't want to talk about this about your dad. And I'm not telling you what I want. And I said, well, you should probably tell me at some point, because I'm going to be making those decisions.
Right.
Like, you're the woman, you're the healthier person. You're going to outlive him. This was years before either one of them got sick. And I was like, and I'm not religious, and I'm very practical, and I'm a physician. So do you want me to make this decision for you? Because I think that's...
Maybe it's not what you want. It could be not what you want. And I want to be respectful. Yeah. And that's hard.
And I was, because I'm the family asshole. I'm the family asshole. I know that comes as a huge surprise.
It's shocking.
But I just said, I was like, if you don't let me know, I'm going to do whatever I want.
Yeah, and
you might not be pleased. And she's like, well, my soul will be with Jesus. And I was like, all right, then.
Fair.
All right.
It's very common. People don't want that conversation. Mm-hmm. When I worked palliative care, I would have to do that conversation. I have to come in and be like, hey, so the doctor gave me a referral, which is confusing, right? Because they're like, well, the doctor didn't tell me this. Oh, you're right. Well, I'm here to talk about end-of-life care. And they're like, what? So it could be a little overwhelming, but, and going through all the things, and people are just dumbfounded.
Oh my God, how about a little heads up, people?
That's very common. That's very common.
Palliative care? What
palliative
does that
care.
mean?
I love palliative care. It's great. I wish that, every hospital, every facility had it, because it's so helpful. Because of that conversation, right? I'm great at that conversation now. I could talk about end of life and planning to almost anybody now. But when I was younger and I was like, let the doctor didn't talk about this first. It's a little overwhelming,
Yeah.
So.
Especially when people are like, I don't know who you are and what we're talking about.
I don't even know what palliative means. That sounds terrible. Yeah.
Oh my God.
But
I have a weird transition.
That's okay. Let's do it.
So sometimes we feel like we want to die, but we're not dying.
Yeah.
And often it's because of hormones.
Yeah. Absolutely.
Tell me about your relationship with those things.
So I have, I don't think it's as rare as I'm being told, but I have a hormonal issue. I have PMDD, which is premenstrual dysphoric disorder, which means 10 to 14 days before my cycle starts, I get a little psychotic, very depressed, very suicidal, very just not in my right mind. And because I've dealt with it for so long and I've in medical field, I've done my research and I've pretty much been tracking my life for the last 20 years. I know that it's a cycle. I know that it's this disorder. I didn't go to a doctor and talk about it for many years because I was like, they're going to think I'm bipolar because it's such a switch. It's one extreme to the other. I'm either crying hysterically or I'm like, oh, I might rape that guy. It's a little rough. It's a little hard in between. So the hormones are a lot, right? It's need some help with that. And that's a difficult conversation too, especially if you're not within the age range of hormone therapy.
Right.
I'm technically 37 and I'm not in the age range to talk about hormone therapy. So
even though your hormones are screwing with your life.
True. And I've paid lots of money and seen lots of alternative physicians. I've bought my own lab results. I've done all kinds of things to advocate for myself. But again, at the end of the day, I still need a physician. I need someone to help explain this stuff because I'm good with the end of life stuff, not so great with hormone stuff. I know me and what works well for me, but you know, I'm an individual and I need someone to talk about that stuff and make it relatable.
Yes.
Because sometimes it's very debilitating and I look completely psychotic. I've been offered many medications for that time of the month, which as a healthcare provider, I was a little shocked at how willing they were to give me, but I did probably need it at the moment. So thankful for it at the same time.
We like our pills.
We do.
We like to make things better with medication.
Yep.
And oftentimes the patients insist upon it. They're expecting something
Very
too.
much true.
Right?
Very much.
And so I think it can be two-sided and then 100%. You end up with not a good thing. And especially right now where, you know, you're lucky to get 8 minutes with somebody.
Yes, 100%. Right? And that's, you got to find someone you need to talk to, you want to be with. I'm almost to the point where, right, doing the math and weighing risk versus benefit, I think I'm done paying for health insurance. I think I'd rather pay for a concierge physician because insurance is regulated. They have their rules, their regulations, so does the physician. You can't order certain tests and do these things because you know that's going to charge me $8 billion and I can't afford that, nor am I going to pay for it, right?
Right.
So hands are crossed. So if you do things more, you know, on the alternative side or concierge side, sometimes you're going to pay cash pay anyways. That's kind of part of the program. But I'm going to have a full-on conversation with you and talk to you like this and explain my life and what's going on. And you don't got someone knocking on the door saying, Cari, we've been waiting for you.
You have 3 other patients.
You're 10 minutes behind, so that means you're 40 minutes behind.
Yeah.
So, right. And that's hard too, right? And I sympathize because I'm in healthcare. I can't tell you how many times I walk into a doctor's office and I just sob and I'm like, I know you can't even do anything about it. I know your hands are crossed too. But like, what about me?
No, everybody is screwed. The only people who are not screwed by what's happening with our healthcare system and insurance are the CEO, like the people in the C-suite and the insurance companies, and maybe the hospitals too.
Probably.
But it does not behoove the patient and the provider. Like that relationship is so bad. Like you think dating apps are bad?
Yes.
This is the most dysfunctional and abusive relationship you could possibly be in.
That's funny you say that because I have never thought about that, but because I'm in that, yeah, absolutely. It's like a terrible dating app.
It's terrible. And the horrible thing is like you can't just have a cup of coffee and leave. Like
no.
You're going to see that person again.
Yep.
No.
And in 4 months, if you're lucky.
Right.
And again, if you can write down all your things and get the conversation had or, you know, whatnot. It's a lot.
Well, most people don't come in with like clear, concise.
That's true as well.
Concerns. Like, this is what I'm worried about. What can we do about these things? This, you know, and then you're playing catch up for several minutes.
Yep.
And then just as you get on a roll,
Yep.
the provider's like, I gotta go.
Right.
Right?
And they're halfway through their story and you're, I gotta, yeah.
Right.
Mm-hmm.
And then you get to start all over next time. And then you start all over next time. And that it just doesn't work very well at all.
It doesn't. Not a lot of continuity of care, right? I get it. People have to do what they gotta do, but that's kind of hard too. You see your practitioner, you think you got a great conversation, and the next time you're seeing the NP or the PA. Mm-hmm. And it's like, they're fine too, that's all great. I would take one PA over 8 people. Just give me one. I don't care what your credentials are, as long as we, you know what I mean, I can talk to you and have a great conversation, and you're advocating for me, then let's do it. But I want the same person every time. Yeah. I don't want to tell my story 15 times. I want to talk about it with you because you know me, you know?
Yeah, it's establishing that rapport and that relationship. Yeah, and not starting over from the beginning every time. That has to be so frustrating, especially when you have something that's unusual, that is like messing with your mental health.
Yep.
And it's like, I don't need to be this vulnerable to a bunch of different people.
And that's, and that's rough too. And again, because I'm like very self-aware, I'm like, oh my gosh, if I don't say this the right way, or if it don't convey it the right way, I'm going to be misdiagnosed and I'm going to be told I'm crazy. But, I just self-advocacy for myself, for anybody else.
Let's circle back to this whole raping thing.
Yeah.
Why are you jumping on people?
Oh, when I'm ovulating, it's rough. Oh, I walk in, I'm not even looking at their faces. I'm just looking at their necks bulge. Oh my gosh, it's rough. It's a little rough when I'm ovulating.
Very nice.
It's kind of nice. So I was like, I don't know if it's my 30s. I don't know if it's the PMDD. A little bit of everything. That week's great. I mean, sort of, right? If people can keep up. That's a great week. It's the week after that's you're like, oh, not so much, you know. But you got a good 10 days out of the month. It's pretty smooth.
We're not supposed to talk about that. Women aren't supposed to be horny.
Oh no, God, no. That's terrible. That's awful. I've kind of come up with that too, where I'm like, I don't really care anymore. Like, I just post-divorce and just kind of be wild and free and like not put into a little box of who I'm supposed to be. I'm like, I fucking love it. I like that I'm kind of wild and nuts and curious, and I want to fucking see it all, do it all, try it all. Let's do it. Like, right? Life is short.
Life is
super short, right? I don't want to be. Difficult conversations are going to be difficult, but hey, it'd be nice if you find a person like you vibe well and you can have a difficult conversation, right? And then maybe some fun happens. It's cool. Let's try it out.
Yes, I think that in our society we do not prioritize pleasure nearly enough.
Oh gosh,
you're just
no.
supposed to be pushing and pushing and pushing.
Oh,
and
it's
working
terrible.
And working and working, and then all the fun and the pleasure is like, oh, I'll have that every once in a while, and I'm like, I'm sorry. We might eke out 80 years. We should be plugging the pleasure pretty regularly.
It's good for your health. It's good for everything, right?
Exactly. And
it's a great day.
Typically, it's free.
Yes. Right? Yep.
I mean,
solo or with a partner, it should be free.
Exactly.
Right?
Correct.
But
I'm all about that.
Right. I think everybody should, right? I don't know why we're not all doing it, but.
I mean, I can see some people are like, libidos are different. Like, they're different for everybody.
I'll give you
that.
And I
get that. Like, not everybody can be walking around looking at people's necks.
True. It's true. It's very true.
I'm looking at their shoulders.
Yeah, see? All right. Yeah. Trust me, I was like, I don't know why. I'm like, yum.
All right.
Right?
I know. You want to sink your teeth into that.
Definitely.
Okay.
Yep. I know. It's kind of wild.
Good on you.
It is.
Good for them, too.
Right? Mm-hmm. Yeah, they can keep on.
No, I think there needs to be more conversations about the fact that, like, it's not just dudes who are walking around trying to get some. Like, hello, so are we.
Right. I can't tell you the women who are like, you're so wild. Oh my gosh, Kim. Like, I wish I was like that. I'm like, why aren't you? Let's do it. Let's go. Like, why aren't you? Let's have fun. Why aren't you having a great time? Even if you're by yourself, why aren't you having a great time?
Oh my gosh.
Like, I don't understand that.
Yeah.
What, right? Like I was talking about the mirror. Why have you never looked at it?
Mm-hmm.
That's important.
Yes.
Yeah.
Have a relationship with her.
Most definitely.
Yes.
How do you know what you like if you never tried it? How do you know what's weird if you didn't look when it was right?
Mm-hmm.
It's odd to me how strange the sex conversation is, especially with women.
Healthcare providers should not be the people who recognize your vulva the best. You should be.
I agree with
you
that.
should be able to go, so like at 9 o'clock, there's this new weird thing that's happening.
Right.
Or I'm concerned that my labia are getting flippy flappy. Or, you know, I can't find my clitoris. Like, go find that girl. Like, don't let her be lonely.
The amount of women, right, who don't know how to pleasure themselves, or have never explored, they're nervous, they're shy, whatever their deal is kind of baffling to me. It's mind-boggling to me, especially the older generation, older than me, right? So I would say like 45 plus, those women don't talk about it at all. They don't want to talk about it whatsoever. Women my age, a little bit more, but still, it's still kind of like taboo and like, no, just like keep that to yourself. No.
Yeah, I do have to say that the porn industry is very contentious.
Yes.
But, like, back in the day, we were looking at, you know, people in the Sears catalog in underwear arena, like still pictures.
100%.
On yellow pages. Like, that was not good. And so it's gone, in my opinion, I think it's gone too far in that, like, the porn industry often makes things look like they simply cannot be. Not
True.
Everyone looks
very
like
unrealistic.
That.
Yes.
Nobody's that perfect.
No.
It's kind of ridiculous.
Agreed.
Yeah.
And so easy to access. It kind of takes the fun out of it.
Yeah.
It's just like I can get whatever I want in 38 seconds.
Exactly.
Kind of makes you like, I can see that. Yeah.
Which of these 60 genres do you want to watch? Which
Right.
are your 7 favorites? We'll just cue that up for you. Yeah, I don't agree with that because I think it sets people up with
failure.
Expectations that just are completely unrealistic.
I would agree with that.
But like at least we can look at vulvas and we can see that everybody looks a little bit different.
Yep.
And like I'm hoping that people then don't compare to each other. Like
They totally do though. They absolutely do, right? Women, not so much, I think, right? Because we've all had, a lot of us have had babies and you've kind of done that sort of thing and you're like, yeah. But men, no. Men, they absolutely compare themselves. They all think that, which is kind of funny, right? But
the
I'm like,
sword fighting.
Yeah, I'm like, that's not real, right? Those are paid actors. They're
paid.
A bunch of people who like waited in line and like they were well endowed on purpose. This was all part of it.
Yes.
That's not normal.
And then they get itty bitty petite women.
Right.
So that they look bigger and everything's out of proportion.
Thing. Yeah.
Nobody has any rolls and nobody's sweating. Like, come on.
Exactly.
There should be sweating and giggling and rolls and like muffin tops to grab.
Mid-conversation weirdness.
Yes.
100%.
The awkwarder, the better. That's how you know you're doing it right.
Yeah, exactly. Yeah.
Yeah. And I don't like the polished porn. It's so sterile.
I've stopped for years. Yeah. If you're too pretty or if you're not relatable to me, I'm not really into it. It's got to be relatable.
I'm going to give this up. I actually kind of like Make Love Not Porn.
Okay.
Have you heard of this?
No.
So Make Love Not Porn is amateur porn. And you send your videos in and you potentially make money off of it. So like, right?
Yes.
So if you're kind of an exhibitionist or you want to do that, then you can upload your stuff and people might pay you some money to look at it. Or those of us who are voyeurs, ding, ding, ding.
Yeah,
then
watch it.
We get to watch amateur porn with people who are real and awkward and funny.
I kind of love that.
There's all sorts of weird genres.
Yeah.
People are wearing costumes and like there's all sorts of different
just
setups.
like regular freaking people, man.
I
love that.
People.
Yes. Oh my gosh, I love that.
Some
That's
of it
super
is
cool.
super vanilla. Some of it is super kinky and weird.
Just whatever your flavor is, but like amateur. I dig. That's really cool.
I know.
I hadn't heard of that.
I love that side.
It almost reminds me of OnlyFans, right? But it sounds better.
I think it's less polished. It's more just off the cuff, like, hey, we went camping last weekend.
Right, had a great time. We made our own video.
Yeah.
And we kind of get off and letting people watch it. Hell yeah, that's way cool.
Right?
I like that. Yeah.
I think it brings the exhibitionists and the voyeurs together, which is probably what should be done.
Yeah. No, that sounds fun, actually.
Yeah.
Nice little light bulb moment.
So death and sex.
Yeah, I know.
Both of them are pretty much inevitable.
And yeah. You're never going to get out of one or the other, right? Well, you should be doing sex more than...
I know, I'm going back to the cousins, like, I don't know if the nun and the monk... Oh my God, were they celibate their whole lives?
I was going to say, I think you would all have to be. How do you do it? If you get a taste of it, how do you give it up? I guess if it's good. If it's terrible, you could give it up, I'm sure.
That makes me sad for them now.
I know. Not if they've never had it. Then you can't mess with something you've never had, right?
I mean, I hope they probably couldn't like keep toys, but
no.
maybe just their
because you're
fingers.
supposed to be 100% celibate, right? You're not even supposed to yourself, I thought.
I don't know.
No, I'm pretty sure, like, because every time I'm like, I'm celibate, they're like, that means you can't do you either. And I was like, oh, then I'm not celibate. Just kidding.
What's the new guy's name? Pope Leo?
Yeah, I think so.
Maybe
yeah.
he can come out and do something about that. That seems limiting.
I mean, I'm kind of curious. Mm-hmm. Yeah, the curiosity is going to kill me now.
I know, right? I actually got my first vibrator during my bachelorette party when I was getting married.
Samesies. Yeah.
And that seemed so inappropriate. I'm like, I'm marrying one.
Why,
I don't
right?
need another one. And my friend was like, you're welcome.
Yeah.
I was like, oh my God. And I just put it away somewhere.
Yep.
Thank you, Peg. Love you.
I was going to say, yeah, that didn't come into play for years later, but I was like, I'm so glad somebody had bought this for me, right? Like, that's cool.
Yeah.
That was a nice, right? But I remember thinking that same thing at the time. I was like, why the fuck would you do this?
I know, what a strange gift to give.
It almost feels like rude. Like, why would you think that, like, you know what I mean?
Are you insinuating
right,
something?
that, like, think we don't have great sex or something? Or, like, you know? I was almost like, the fuck?
Right? And it wasn't like I wasn't getting good sex.
Right.
It was just an enhancement, like, oh my goodness.
Right. Oh, where's this been?
Right.
Well, this is cool. Yeah.
I think it's that curiosity. It's that, and just being open-minded to.
Right. The open-mindedness to everything. I think that's healthcare, death, dying, sex, being open-minded.
Yes.
It doesn't all have to be the same. We're all different and individual, and you can make whatever the fuck you want. That's the best part.
I think that's the fun part.
Yeah.
Absolutely. Sometimes it hurts. Sometimes it hurts really bad. But that is what makes the world go round and makes it super delicious.
Yeah. Couldn't appreciate it if it didn't hurt so bad.
That's right. That's what one of my friends told me when I was really, really hardcore grieving for my dad, is she said, grief is the flip side of gratitude. She's like, if you didn't have gratitude for having him in your life, then you wouldn't grieve.
Oh, that's beautiful.
And I was like,
I was gonna say, I'm gonna keep that now. That's a good one. I'm gonna keep that one. That's a good one.
I feel all the little chills too.
Yeah, I know. I just got some goosebumps on my arms. Yeah.
And that's so true. I mean, if something doesn't mean something to you, you don't care if you lose it.
100%.
Who cares?
Right. Yeah. So even meaningful sex.
Yes.
Right. If it's not that great, if it doesn't feel good, or if the meaning is there, you're like, I can go without it.
Mm-hmm.
But when it's amazing, I want it all day, every day.
Yes.
I want to indulge in it. Just
exactly.
like in life.
It does make your life better.
Yeah. Absolutely. All the ways.
For fuck's sake, people. This is Kim Riley Brown. And I've had a blast with you, friend.
Me too.
I'm
it's
so
been a long
glad
time.
We reconnected.
I know. It's been forever. I love this.
Oh my God. Thanks for watching, guys. Maybe I'll have her back, don't you think?
Yes, please.
Oh, yeah.
I want to talk about all the things. Yes.
Right on.